You are listening to the Opioid Affected Youth Initiative's podcast, Answering the Call. In each of the featured episodes, we will hear from experts from the field who will go in depth with their personal stories and experiences in responding to the opioid epidemic throughout communities across the country. This podcast is supported by the Office of Juvenile Justice and Delinquency Prevention. The opinions, findings, and conclusions or recommendations expressed in this podcast do not necessarily reflect those of the U.S. Department of Justice.
Hello, the Opioid Affected Youth Initiative is proud and excited to present this episode of the Answering the Call podcast series entitled Voices Amidst the Opioid Storm, Navigating the Opioid Crisis in the LGBTQ Community. Before we get into this topic, I want to just cover previous episodes have focused on mental health providers, emergency medical systems, law enforcement, human trafficking, and the application of restorative justice process. In today's episode, we're going to delve into the opioid crisis and its significant impacts on a highly impacted community. This podcast will explore the unique challenges faced by LGBTQ plus individuals in the United States, shedding light on the intersection of substance use, mental health, and social stigma. We will also uncover the root causes of addiction's grip on the LGBTQ plus community, examine the barriers to accessing treatment, and celebrate the triumphs of those who were able to navigate the system of care to find positive outcomes. Finally, at the end, we will highlight some resources that are available to you or a loved one to take a step toward recovery. To kind of provide some statistics and kind of share why this is such an important topic and why we discuss the LGBTQ community, there's again address some general perspectives. According to the 2022 survey by the National Center for Transgender Equality, 20% of trans adults reported past year non-medical prescription opioid use, compared to 8% of cisgender adults. So cisgender, for those that may not know, are those that identify as the gender that they were assigned at birth. So if you were assigned male at birth, that means that, and you identify as a man, that is what the term cisgender means, in case you are unfamiliar. Transgender in this context is anyone who identifies as a gender that is not the assigned gender at birth. 18% of transgender adults reported that within the past year heroin use, compared to 2% of cisgender adults. And 24% of transgender adults reported past year non-medical prescription opioid or heroin use, compared to 7% of cisgender adults. Another study done in 2021 by SAMHSA, the Substance Abuse and Mental Health Services Administration, found that 22% of LGBTQ plus adults reported past year non-medical prescription opioid use, compared to 8% of heterosexual adults. 14% of LGBTQ plus adults reported past year heroin use, compared to 1% of heterosexual adults. And in a 2020 study by the Trevor Project, they found that 45% of transgender and non-binary youth reported seriously considering suicide in the past year, compared to 14% of cisgender youth. And 36% of transgender and non-binary youth reported attempting suicide in the past year, compared to 9% of cisgender youth. So I hope by sharing those statistics, you have a better sense of why we're focusing on the LGBTQ plus community, as it is clear that compared to their cisgender and heterosexual counterparts, addiction and substance use tends to impact this community heavily. Now, to introduce myself, my name is Dishon Laing, and I am the Youth Prevention Program Director within the Boston Public Health Commission's Office of Recovery Services. Boston Public Health Commission is the nation's first health department and hosts over 1,000 employees to support hundreds of programs organized into 6 different bureaus. This topic is specifically important to me because I myself identify as a Black gay man who has seen many friends and family experience substance use disorder, and I work actively towards ways to reduce the harms of substance use within communities that have been made vulnerable by our society. I co-chair an initiative known as the Boston Youth Resiliency and Recovery Collaborative, which was established through the OJJDP Opioid Affected Youth Initiative. So we are one of the grantees of the Opioid Affected Youth Initiative. Our grant's focus has actually been engaging LGBTQ plus communities through developing a BIPOC, so Black, Indigenous, Latinx, and other people of color, LGBTQ plus mentoring program, and increasing education about substance use and how it affects LGBTQ plus populations. I will now pass it on to our guest speaker, Stephen, to help introduce himself.
Wonderful, Dishon. Thank you so much. And it's wonderful to be with you all. I'm Stephen Haden. My pronouns are he and him. I'm the CEO and founder of Envision You, which is a nonprofit focused on addressing the mental health and well-being of the LGBTQ community. I've also founded a tech startup that will be launching a new smartphone app in 2024 called You Flourish, focused again on the well-being of the LGBTQ community. I'm a social worker, therapist, and I'm also a person with lived experience. I've been in recovery from a substance use disorder for about 18 years, and I'm also a suicide survivor. So as a gay man with my own unique mental health challenges, I'm working every day to give hope and opportunity to members of our community, and I'm delighted to be with you today to talk about this important topic. So to provide some additional context, as many of you all know, the opioid crisis is a public health emergency in the United States. It is estimated that more than 100,000 people died from drug overdoses in 2021, with prescription opioids and heroin being the leading causes of death. LGBTQ individuals are particularly vulnerable to the opioid crisis, as we heard from some of the statistics shared earlier. Studies have shown that LGBTQ individuals are more likely to misuse prescription opioids, to inject drugs, and to overdose compared to heterosexual individuals. In addition, LGBTQ individuals are more likely to experience mental health problems, which are a risk factor for substance abuse. We'll talk more about those risk factors and some of the protective factors and resources that can support you towards a life of well-being.
Thank you so much for that context and overview, Stephen. So before we kind of dive right into the topic, we do want to provide a little bit more of an overview of substance use disorder generally. Many of us probably remember the days when substance use messaging was shared as the fault of those who use drugs. Personally, I got the DARE program, where the message was essentially just say no to drugs. That message for some people sticks, and for many others that I know personally and have seen, it kind of fades away with time. However, that message tends to imply that anyone who has an addiction it's at the fault of that individual person. And so a lot of us grew up with that messaging, and therefore that has had longer lasting implications than, though the idea was to prevent the spread of addiction and prevent misuse of substances. Today, our understanding of addiction has grown to know that someone who uses substances, it's larger than just saying no, and that the risk of addiction goes beyond just personal control. And so some of those factors I just want to outline would be like biological factors. We do know today that genetics can play a very significant role in whether someone develops a substance use disorder. Families, we see addiction run in the families, as well as, so if someone's parents has a substance use disorder, we see that their children are much more likely to develop that in the future. As well as if anyone has any pre-existing mental health conditions. So a lot of times you'll hear today the talk about substance use disorder or addiction and mental health, and we do see a lot of overlap between the two. So in some ways, if someone has an existing mental health condition, that can make them more vulnerable to developing an addiction. And if someone also develops a substance use disorder, this can also trigger additional mental health conditions that they may not have experienced yet. But outside of the biological factors, there's also the environment that people grow up in. And so this could be parents' use and attitudes, whether or not it was supported in their home, whether they saw their families drinking, smoking, using substances themselves, or like they got the message from their families around the not to use. Also, their peer influences. What are their peers like that are around them? Are their peers individuals who are using consistently, who are also encouraging them? Again, we hear a lot around like peer pressure, especially when it comes to young people. And in today's environment, that's more than just the people that they interact with on a one-to-one basis. There's also includes like social media and what the messages they receive around substance use in that capacity. Also, what are their community attitudes? Do people grow up in communities that foster positive engagement and positive coping? Or do they have liquor stores every block? Do they have, especially within many states where we have legalization of marijuana dispensaries, increasingly available in many communities? Or again, when could you get cigarettes at the corner store? Could you get it from and in many other places? Do you feel to walk into a CVS or Walgreens and buy cigarettes? So how available are these? Is it in their community? As well as some things that especially a lot of young people or people do not have control of are adverse childhood experiences or ACEs. Also, maybe from like previous childhood trauma and or abuse. We see a very strong connection between those who experience these adverse childhood experiences, which there could be many different types, and their connection to coping with those experiences through the use of substances. Outside of the environmental and biological factors, then there's the substance specific ones. So how early does someone start using? We see that folks who are in treatment, a lot of them have reported starting their use back when they were 17 or younger, and some even started before 14. How someone chooses to use substances. So we think about absorption, as in through different mucus linings. So either through the skin, through the gums, even through the anus. Intravenous, which would be using injection or using the bloodstream. Ingestion, so that would be eating or drinking, so something similar to alcohol, or for like a lot of folks who are ingesting edibles with marijuana, and then inhalation in terms of using it through their breath. And then what is the impact of the drug itself? So some substances are at a higher risk of addiction than others, especially when thinking about how often and frequency of use is involved. So all of these factors take a role in how they impact anyone's brain mechanisms. And once the substance has started to shift someone's brain, chemically change it so that they then start to develop this addiction, this is where we can kind of see this playing out. You'll hear a bit more from Stephen later on some specifically on how maybe this may interact. But I do want to highlight specifically when you think about LGBTQ folks, parents' use and attitudes, a lot of young people experience rejection from their home when they come out as LGBTQ, whether it be for gender or for sexual identity. And so that sense of rejection can have another impact, especially when you think about peer influences. Many LGBTQ people who are finding support, I can even speak for myself. When I came out, I sought out LGBTQ spaces, and which were great for bringing community together and creating collective support. But you would see a lot of your peers outside smoking cigarettes or having a drink or invited to go out and party, because that was the message that people kind of got on how people in this community engage with each other. And so just kind of how you cope. So I think it's important that we think about what is the lifestyle as well that people are kind of introduced to and expected to deal with. And so now I'm going to kind of pass it back over to you, Stephen, to talk a bit more about substance misuse, mental health, and the social stigma within LGBTQ communities.
Yeah, so thank you. The LGBTQ community faces a unique set of challenges, as we've been talking about, related to substance misuse, mental health, and social stigma. These challenges can be compounded by the fact that LGBTQ individuals are often marginalized and discriminated against. I think about the people that I talk to around the country, and if you're living in fear every day that somebody finds out that you're queer, that you could lose your job. Just imagine the stress that you're under, that fear of losing employment, the source of income that you have to live, and what the consequences could be from that. So that's just one example of why members of our community live at higher levels of stress and anxiety, which leads to a whole series of challenging mental health concerns, including substance misuse. When you live in a society that's not built for you, when you're experiencing microaggressions, discrimination, and stress every single day of your life, you certainly are going to be thinking about opportunities to find relief and escape and help to numb some of those feelings of isolation, disconnection, and that sense of just being othered all the time. And frankly, also in many cases, not feeling safe. Is it safe for me to walk down the streets in my community holding my partner's hand? Is it safe for me to go into a space and just live my authentic self? Well, often the answer is no. So indeed, members of our community do experience more mental health problems, in part, as Dishon mentioned, those adverse childhood experiences. So for young LGBTQ individuals, they experience rates of ACEs at 3 to 4 times greater than cisgender straight kids. Why does that matter? Because 4 or more ACEs, which is really that tipping point, lead to a lifetime of physical and mental health challenges, greater degree of problematic health, chronic health issues, mental health concerns. It affects both quality of life and life longevity. And then there's the social stigma that exists. And this is true across the board. I think we've seen some progress in how we talk about mental health and substance use. But as mentioned earlier, it's still so often blamed on the individual, that there's a personal responsibility to something that is, in fact, a disease that requires intervention. And so you're just sort of constantly dealing with the stigma of talking about and asking for help. And it's also true that members of our community who live with a mental health concern experience a dual stigma, which refers to the experience of facing both prejudice and discrimination on multiple levels, often based on intersecting identities. In the context of our discussion today, you think about both mental health and substance use disorders, combined with the fact that of your LGBTQ identity, you're facing multiple stigmas in society. Now, also think about other identities that you might possess. If you're a person of color, depending on your gender identity, what is your socioeconomic standing? Do you live in a community that's resourced or under-resourced? What are your opportunities for housing? All of these things impact who we are and how we show up in the world. So dual stigma can lead to a number of negative consequences in the context of what we're talking about today. So increased social isolation and loneliness is something that we know is a significant concern. Often in recent research, and certainly from the US Surgeon General, we've heard that loneliness is indeed the #1 public health crisis that we are experiencing here in the US. It also leads to reduced self-esteem and self-worth, the fear of seeking help for mental health or substance use problems. Even in my own experience in recovery, asking for help was the most problematic and challenging thing that I experienced. Once I did, I was been able to start taking those steps, albeit small ones at first, towards getting both the help and the recovery that I was seeking. We know it results in greater difficulty in accessing and maintaining treatment. And part of that we'll talk about later is the challenges so many people in our community have in finding affirming care. There's an increased risk of relapse and reoccurrence of mental health or substance use problems. Part of that is so much of our social life exists in spaces that promote drug and alcohol use. So as a person in recovery, particularly if you're early in the recovery, you're thinking about the community that you still want to be a part of. You want to celebrate and have fun with the people that you've been hanging out with, right? Your friends. But you might not be able to do that in the places that you have been accustomed to. So just thinking about what we're giving up or what we're having to think about as part of our recovery journey. And then also we need to remember that we have much higher rates of suicide and other self-harming behaviors in the LGBTQ community. And so it's important that for us as friends, as allies, as professionals, that we're constantly thinking about harm reduction strategies and how we can mitigate the risk of suicide. So, what are some things that can be done to help address this? Part of this is the podcast today, increasing awareness of the prevalence of these issues so that we can get people talking about them. And that's true in the LGBTQ community. In my work, it's often kind of that big thing that's the unspoken concern that we might have with a friend, but it goes unspoken and therefore unaddressed. Working collectively to ensure members of our community receive culturally responsive treatment and support services, addressing the root causes of substance misuse and mental health concerns, including strategies to reduce the number of adverse childhood experiences that young people face, and creating more inclusive and supportive environments for LGBTQ individuals. And this starts in our public school system in America. We need to ensure that we have safe spaces for queer youth to be able to learn and thrive and enjoy all the wonderful things that young people should have access to. I know we're going to be talking about a really important topic now, thinking about how racism intersects with the issues that we're talking about today.
Absolutely. No, and again, I really like how you brought up again these intersecting identities. And I, again, in my own personal experience as well, well, a lot of times, just jumping back to one of the comments you made about that unspoken, issue about, oh, my friends, these are there's maybe some substance use concerns. A lot of times in our friend group or the people I've socialized with, a lot of times it's made as jokes, very joking about how many drinks someone is having, how they're acting on it, and the jokes is really to kind of bring up the topic, but but not in a serious way, because then it becomes, oh, you're the downer of the entire group. And that's still something even as adults we see happening, not just as when we're younger. But again, a lot of times those jokes are a way that people like cope with the stress and struggles that they're dealing with. And one of those especially is racism. And I guess I do want to highlight this because again, the LGBTQ plus community is known for acceptance and love of its members. However, this also does not isolate that community from the different privileges that people have grown up with in addition to their LGBTQ plus identity. And this is especially at least here in America, for folks who identify as non-white, cisgender males. There are many additional stressors that can exist within that community and how they navigate what they're perceived as. Some of these issues would be like hypersexualization. Those that are seen as a person of color. There are many different stereotypes that are associated with being a Black person in the community, or being an Asian individual in the community, or being Latino. There are different stereotypes that come along with that, many ways of like social interaction. So where people can feel like they are now turned into the product of someone's idea. And so even when seeking support and seeking love and seeking acceptance, there is this understanding that, or this interaction with racism that can really sour and can exacerbate someone's stress in not just being not accepted from family, but then moving into a community that may be white dominated and having to address with all the microaggressions that come from being a person of color in this space, or being someone who may be more, less, who maybe have different physical abilities. And especially if someone is identified as trans, that can still be an issue even within the LGBTQ community. One thing that comes up to mind is the way that toxic masculinity can play a role within LGBTQ communities, outside of just being in toxic masculinity being an issue with that all folks in our society deal with, but it still plays roles into relationships. It's thinking about when someone is seeking support, if their partner, is someone that maybe they are more feminine, and they're engaging with a more masculine partner, and needing to call support from cops, not getting that kind of level of support, or being like, oh, well, this is just an issue between you all as two men or you all as two women. Those kind of understandings of interactions when it's not seen as aggressive, or it's not seen as large of an issue because this is happening between people who are perceived to be the same sex, as well as just what is understood. Again, we're thinking about social engagements and social stressors. So someone who is maybe more masculine being told, oh, this is how you're supposed to act and engage. And then the stigma that they address when maybe they act outside of that particular stereotype. And then especially for those who are people of color, a lack of open and affirming spaces. We talked about the need for inclusive and supportive spaces for queer folks. There also needs to be an understanding that those spaces also need to take into context not just someone's LGBTQ plus identity, but also the multiple identities they come into that space in. So not just checking in when we think about what we can do. Is this a safe and inclusive space for LGBTQ folks? And are we still addressing all the other isms and phobias that are present in the world? Are we still making sure that it's safe for someone who is Polynesian to be in this space, someone who may be of indigenous heritage to be in this space? And are we inclusive in supporting everybody? So again, a lot of times I hear the terms like safe spaces and brave spaces. I'm more of a personal fan of brave spaces because it encourages learning. But if we're creating safe spaces, who is it safe for? And really challenging yourselves as providers, as family members, as allies, being like, when I say I'm a safe space or I'm an ally, am I being specific, or am I showing how that is going to be for all folks? And this also goes into how we navigate, the medical system. A lot of folks, when they are navigating systems, it is not just their LGBTQ identity, it's also their multiple intersecting identities and playing a role with what they're experiencing. We know that when specifically Black women are engaging with the medical care system a lot of time and they're exhibiting pain or talking about pain, it gets discounted by their providers, by their doctors. Whether that person identifies as LGBTQ or not, that is something that is still a part of that. And so, Stephen, can you speak a bit more to some of the barriers for accessing treatment for those that may be dealing with opioid addiction and identifying as LGBTQ?
Yeah, absolutely. We'll start with that, and then we'll talk about what is culturally responsive and affirming care. But I do really appreciate the conversation that looks, even more closely at some of those identities that often compound the challenges that we have, both in terms of managing our mental health, but accessing care. And I really love the word brave space, because each of us should be committed to not only creating affirming spaces for folks, but also being willing to learn. None of us are subject matter experts in another person's life. I can assure you of that. And even the most educated and experienced mental health professional needs to understand that the client is the expert in that conversation, the patient in some cases, depending on the language you use. And we need to create those spaces of healing. And to do that, it has to be person-centered. It has to be focused around that individual as the subject matter expert. And then our work as mental health professionals or public health folks is to create the opportunity for us to work together in partnership to pursue whatever those recovery goals are. They're not mine. I don't get to dictate what my clients do. It's all about collaboration, learning what it is that the individual wants in their life, creating a plan that we can work on together, and then hopefully incrementally, step by step, day by day, we're making advancements towards creating possibilities in people's lives that didn't exist before. And as I segue into talking about barriers, I do want to share just a quick anecdote in my own recovery. Early on, so much of the conversation was around consequences. I was constantly reminded if I kept using drugs and alcohol in the way that I was, that I'd lose job, I'd go to jail, I'd end up dead. And all of that's true. And we don't want to be naive and ignore that those are some of the detrimental things that do happen with persistent and chronic substance use. But finally, I had a therapist who said, Stephen, let's think about possibilities. You wake up tomorrow and you're clean and sober, and you're not seeking to get high. What would your day look like? I'm like, wow, okay. I have a dog, I have a job, I get to go hang out with friends. And I kind of listed all the things that are really important to me. And what a paradigm shift. I know the consequences. I can look in the mirror every day and know that I was destroying my life, that I wasn't making choices that were in alignment with my values. But it took that person, that therapist who cared deeply, it was really person centered care, to say, let's talk about possibilities. And all of a sudden, I'm thinking about the future and the things that I get to do. And I'll share with you all today. I have a partner, I have 2 labs. We live in Denver. We get to do a lot of great outdoor stuff. And all of that's possible because I started taking those steps to recovery. And so, what are some of those barriers that exist, right? So, we've talked a little bit about the misinformation, unwillingness, frankly, to talk about mental health. And I appreciate, Dishon, your comment earlier about how often there's some levity, there's some joking around about it, like, oh yeah, so and so had too much to drink last night. And indeed, it is kind of trying to open that conversation, but it's really uncomfortable. It's so difficult to do, particularly I have friends that drink and some use recreational drugs in a way that's not harmful, that's not problematic, doesn't constitute an addiction. And so for them to have a conversation about substance use, invariably it was like, well, wait a second, you all are doing it. Why is it a problem for me? Well, indeed, it was problematic for me. Um, so really trying to lean in and have those conversations so we can create those spaces for people to know that they're not alone, and there's people in their life that care enough about them to say, hey, can I go with you to your first appointment? Or could I go with you to a 12-step meeting? Or could we sit down and look at resources that might be available to help? It really matters so much. Some of the other barriers, frankly, we've talked about, right, is the experience of discrimination from healthcare providers. This is an incredibly challenging issue. I hear today, I see it in the news. We all are aware of legislative efforts underway in many places in the country that allow providers simply to say, I'm opting out. I don't want to provide service to you because I don't agree with or support your identity. That's absolutely unacceptable. Our ethical codes state otherwise. And frankly, if you're in a helping profession and you don't want to help all people, well, I'm here to say you're in the wrong job. Just, we are here to show up to serve people, and it matters what their identities are, but it doesn't matter from a service delivery perspective. So let's be committed to helping and healing people who need our support. Lack of access to affordable care continues to be a problem. We know that so often queer folks are underinsured or uninsured. This is particularly true for transgender folks in this country. And so how do we ensure that people are able to get care once they've had the courage to say, I need help? So much of our healthcare delivery system, and it's changed a little bit with COVID, with telehealth, but so much of it still requires us to show up at a clinic during business hours. I don't know about you all, but so many of us work a day job. Like our hours are pretty consistent. Lots of folks maybe don't have great PTO or opportunities to take paid time off. So how do I get to that 2 o'clock appointment at that clinic across town? I don't have a car. I have to use public transportation. I'm thinking about the time away from work. Well, my boss gave me that opportunity. Also, I can get in for an hour appointment. So I'm glad that we're thinking about hours outside that 8 to 5 model, that we're thinking outside of those physical spaces to give people more access to care. In my clinical practice, I see everyone at night, and it's wonderful. They get to be in the coziness of their own home, the safety of their own sanctuary, and we're able to engage in a therapeutic process that, frankly, I think, really literally, I'm meeting them where they're at rather than asking them to come to where I am. And and another barrier that I think is so often overlooked, and this is true with LGBTQ folks, we have kids too, right? And this is true broadly in society. But if I'm trying to get help and I need to go to these appointments, what does that mean for my child care activities? And so there are a lot of barriers there. And ultimately, what happens, right? People don't seek care, or if they do and they don't find it's an affirming and supportive, they disconnect. And because it's so challenging to find a healthcare provider, frankly, in the US, particularly one who delivers great high quality care to the LGBTQ community, what we find is people just throw up their hands and say, okay, help is not available. Well, not surprisingly, those concerns don't magically go away. And so we see higher rates of acuity, right? People aren't getting those early interventions. They're not getting the support and care they need. So then they find themselves in those more challenging places, up to and including serious thoughts of suicide and self. So as we think about a mental health care system that is built with everyone in mind, we need to make sure it's affordable and accessible and affirming so that people get the care they need. What does that look like? Culturally affirming care is a crucial aspect of effective addiction treatment for everyone, in particular LGBTQ individuals. And this recognizes and respects the unique cultural identities, experiences, and needs of of our community. And by incorporating culturally affirming practices, addiction treatment professionals, mental health providers can create that safe, supportive, and inclusive environment for people seeking care. And this is true both in an inpatient and outpatient setting. So, what are some of the things that we should keep in mind, right? So, we know that our community experiences unique challenges that lead to higher rates of substance misuse and mental health challenges. Culturally affirming providers understand these challenges and tailor treatment approaches accordingly. An important note that I want to share with those of you who are working in this space, it's not the client's job to educate you about their identity. If you're not doing that work, if you're not seeking training before working with populations like LGBTQ folks, I just want to urge you to stop, get that extra training so that you can deliver care and not ask your client to be part of your education process. Building trust and rapport. Culturally affirming care fosters trust and rapport with everyone who is seeking treatment. This trusting relationship is crucial for successful treatment outcomes, right? It builds that strong therapeutic alliance. It increases a client's likelihood of engaging in treatment, and we see much, much better outcomes when that happens. And then promoting self-acceptance and identity affirmation. Culturally affirming care promotes self-acceptance, identity affirmation among members of our community. The self-affirmation is essential for long-term recovery and care. So I just encourage those listening who work in public health or mental health to think about their own training, what biases they might experience, and what are some of the maybe administrative burdens that might hinder a person seeking care. And that includes, and it's so important, just that intake form. As you look at that intake form, would you say that a queer person filling that out is going to feel welcome in your clinic? And I'm going to suggest in many cases the answer is no. So we've got a lot of work to do to build these affirming and supportive places of care. And when that happens, we're going to start to see a significant reduction in these disparities. And I know that's our intent, Dishon and I and others who are working in this space who care so deeply about the.
Yeah, thank you for that. Especially one and again, I do so much work when it comes to developing surveys and sharing that out, and especially that demographic section. It can feel like a very huge administrative burden to be like, am I creating this so that everyone is represented? And it not feel like you're asking people to fill out a 10-page survey to just get through an intake form. So I definitely encourage people to think about ways to do like write-in options, allow people to self-identify and take that information in. And when we think about like the language that folks are using, and like I can tell you from my own personal medical experiences, having to go in and talk to my doctor and educate them about the sex that I am having so that I can get the appropriate medical treatment is very stressful. And I'm lucky that I was educated in how to do it from my engagement in programs. But a lot of folks may not be wanting to have that. So when we think about bias, it's not just like I've been in spaces and had doctors and nurses talk about, oh, well, why aren't you married? Where's your girlfriend or wife? Like these are comments that are microaggressions that people don't think are a big deal. They're kind of normal conversations. They think they're building rapport, but in that you're sharing your bias. Using simple terms like, oh, how many partners. If you're trying, like, partners is a very neutral, generic term that you can use whether someone is engaging in a partnership that may be appearing heterosexual or maybe appearing homosexual. Even the appearance of who someone's partner is does not determine identity. And thinking about how are you also evaluating this learning. I think challenging your biases and getting the trainings are wonderful. They do not do the impact if it's not continuously supported in the system that you're working in, and if it's not checked. Are you doing surveys with clients on, or your clients, patients, whichever kind of engagement you're with people on? Are you doing surveys to assess their input? Understanding that if you are, a lot of times we have these resistance to getting negative or constructive feedback, but it's really helpful for us to kind of grow. Other spaces, if you're looking for additional ways to think about, well, what are my supports out there? I don't know where to go. I don't know where to, this is something I want to embark on. There are definitely national resources that can help direct you to the training, can provide a lot of research. And so I'd like to bring up for SAMHSA's national helpline, which is free, confidential, 24/7, 365-day a year treatment referral, and provides information service in English and Spanish. That number is 1-800-662-4357 or 1-800-662-HELP. There's also the 988 Suicide and Crisis Lifeline. So dialing 988 if someone is having a mental health emergency. The Trans Lifeline, the Trevor Project, GLAD, which is the Gay and Lesbian Alliance Against Defamation, not to be confused with the other GLAD, which is Gay and Lesbian Advocates and Defenders. There's also the Human Rights Campaign, or HRC, the National Center for Transgender Equality, and for PFLAG, for parents, families, and friends of lesbians and gays. So again, there's a network of allies out there to help support you and help answer questions, so you don't always have to turn to your LGBTQ plus identified friends to educate you. With that, do you have any kind of closing remarks for us, Stephen?
I do, yeah. And thanks for sharing those resources. And I think part of this is just a reminder, you're not alone. When you're in those dark days feeling hopeless and you think that a better day is not ahead, I hope one of the takeaways from our conversation today is just reminding you that there is a community out there that cares about you. There are people working every day to support your well-being, and there are resources that will help you navigate this journey. And if we think about this from a harm reduction perspective, this is not about shaming people, telling people you've got to stop using, that what you're doing in some way is wrong. That is absolutely the wrong approach. But what I can tell you is when you start working with people who think about incremental change, working in collaboration and partnership with you to think about what a better life looks like, great things can happen. And I'm proof today. I'm alive and thriving because I listened to people. I reached out and got that help, and I hope you'll do the same. Dishon, it's been an absolute pleasure working with you today on this show. Grateful for everyone who's joined us and turned in to learn more about this really critically important topic. And I invite each of you to check out previous episodes by going to the Opioid Affected Youth Initiative's YouTube channel, Buzzsprout, and in any of the other platforms that you'll be directed to through Buzzsprout. We hope you'll stay engaged and tune in future episodes, and really appreciate everyone's commitment to not only thinking about their well-being, but how do we create spaces where people, those brave spaces that Dishon mentioned, where we can encourage conversations about recovery and getting help. So thanks again for joining us, and I wish each of you a life filled with wellness and well-being.
The Opioid Affected Youth Initiative is deeply committed to supporting the science and community-based efforts to combat the opioid crisis. The discussions that are part of these podcasts support this level of commitment. For additional information regarding the Opioid Initiative, visit us at www.opioidaffectedyouth.org. We also invite you to subscribe to our YouTube channel to view upcoming broadcasts, or simply send us an email requesting appropriate links at oayi-info@iira.com.